Loss comes in many forms, and usually in unexpected ways. It can be devastating, leaving you facing an uphill struggle to go on with life without someone you thought would always be there. But life does go on, and even in the deepest despair, we can find hope. Welcome to Grief Relief with your hosts, Drs. Gloria and Heidi Horsley, brought to you by the Open to Hope Foundation, helping people find hope after loss. And now here's Dr. Gloria and Dr. Heidi.
Welcome to the Grief Relief Show. I'm your host, Dr. Gloria Horsley, with my co-host and daughter, Heidi.
Good morning. Hello. Hi, Mom.
Hi, Heidi. Well, we've got a show that's really interesting because we have been talking about EMDR, which is a method of treating trauma, for a long time, you and I, and neither of us have really known exactly the process, right?
Yes, and I love that we're doing a show on this because, as a lot of you know out there, I worked with firefighter families after 9/11 for many, many years, and they really were stuck in the trauma narrative, and I did a lot of groups and a lot of therapy with them, and a bunch of firefighters from one of my groups went and did EMDR, and they said it absolutely changed their life.
Mm-hmm. And that's a rapid eye desensitization process, and we'll be telling you about it, and you will be able to think about whether you or maybe one of your family members who's had a loss and seen a trauma might benefit from this type of treatment. So I think it's going to be very educational. And the people that are going to help us with this are Jean Schellenberg. She's Dr. Jean Schellenberg. She's been doing EMDR for a long time, and also we're going to have Christopher Sato Perry is going to be on, Dr. Christopher Sato Perry, and he's going to talk to us about what the treatment is and about how he uses it. And then we're going to have a little video clip from Francine Shapiro, who developed this process, and you're going to find it very interesting how she developed this process as a graduate student at Stanford for treating trauma. And then Randy Cookson is going to take us out of our show with a segment on the keyboard that he wrote for his wife. So sounds like a really interesting show.
I'm looking forward to it and interested in it.
All right.
Yeah.
Hello, and welcome to you, Dr. Sato.
Welcome.
Thank you for having me. It's wonderful to be here.
Thank you for being on.
So, first of all, we're going to have you. We're going to write down what EMDR was. And we forgot to write it down. It's a long word. We know what the process is, but what does EMDR stand for?
Okay, the whole thing is a memory test.
Yes.
Eye movement, desensitization, and reprocessing.
Okay.
Okay.
And it's an interesting name because it was the initial name, and they've stuck to it, and it's become famous worldwide, well known, mostly as EMDR. But at the core of it is bilateralization. The idea of the eye movements moving from side to side is a component of it, but what's very key is actually the idea of whether it's eye movements or sound from side to side or even tapping on knees or shoulder. These days some people will put on headphones and have sensors in their hands and see something on a computer screen if they wish, or a light bar. But the idea is bilateralization of the brain. This is very much a brain, making the best of the brain, what we know of the brain. Because as we get the attention going side to side, one way or another, we're lighting up the corpus callosum. We're lighting up what connects the two brains and different parts of the brain so that thought and affect are flowing.
As I remember from nursing school, the brain kind of looks like a walnut, right?
Yes, that's right. And that's, if we're lucky, we're eating walnuts and all those good things.
And the corpus callosum is that center, and then the two sides there. So we're trying to do something with those two sides.
Thought and affect, getting it.
What I'm wondering is getting out of the technical end of it, because I really don't know what you guys are talking about right now.
But your brain does.
Yeah, right. I didn't know tapping was part of all this, too.
Can be tapping.
Okay.
Some people actually might have something with their eyes. You know, it's just not, we want to find what their comfort is, whether it's through the eyes or tapping or sound through headphones, a mix. Actually, I find that when it's just something in someone's comfort zone, so that they can just go internal. the funny thing is all these things are external, but what they're really doing is getting us to go internal so that we know from fMRI studies, functional MRI studies, the corpus callosum, the bridging the two parts of the brain and different parts of the brain, is lighting up in functional MRI. And people come to, I think of it as a game of connect the dots. Suddenly, within themselves, not hearing someone else in the world tell them what they should think or feel, but within themselves, they're connecting the dots, not just ideas, but the feelings that go with it. And it's as if they're able to access more of their own inner wisdom.
Okay, so Christopher, let me get this straight. So what EMDR is that you've got a thought and then you've got a feeling around it. And people get overwhelmed by the feelings that go with the trauma, right?
That's right.
And so you're doing something, it sounds like, to reprogram so that they still have the thoughts.
Yes.
But the feelings are not so overwhelming.
Yes, as much as people might say, sometimes I just don't want to think of this at all. Certainly some things we want to leave to the past. I don't want any memory of it. Actually, it's not the memory of it that's the painful part.
Okay.
It's the emotional overload, the physical overload. There's something that what we want to do is kind of discharge that physical, emotional overload that has been intrusive.
Okay, now here I am, and I had a friend whose husband had a heart attack, fell on the ground. She found him, and she did mouth-to-mouth resuscitation, which is sometimes not a pretty thing because there's foam and all sorts of things involved with it.
Very physical.
And, very physical, and he died. He didn't come out of it, and I talked to her probably 10 years later and was just talking to her about her life and functioning a friend, and she said, I said, well, how did your husband die? Wow. All of a sudden she was back into that, immediately into that experience. And, and you could tell she was, I could hear it. So she told me all the details of it. Well, a lot of emotion around it. And it wasn't a happy thing for her.
A lot of emotion. And I would have to wonder if a lot of sensation, a lot of sound, the breathing, I would imagine the breathing could be quite haunting for her. Her breathing, his breathing or not breathing, his struggle with it. The various sensations, sight, sound, smell, taste, touch, temperature, just the heat of some of these traumatic moments. So this is where the emotions, the sensations, so much comes in. And as you know, with grief, we also quickly get into a sense of the social, the philosophical, the spiritual. So that sense of there's a lot happening in a sensory way there, and quickly it becomes beyond the sensory.
Now, what if I said, why don't you try EMDR, this rapid eye, this reprogramming around this event?
Yeah.
And she was intrigued, and I don't know if she ever followed up on it, but that might be so risky to somebody.
It might be risky to change. In fact, this is an issue I'm sure you're so familiar with grief. We often are holding on to memories, sometimes feeling that's our connection. And there's someone who's lost a spouse. I have a deep sensitivity to how they might not want to let go out of a belief that this is how I'm connected to this person, and this is how I honor this person. But what we do is we say, in fact, we want you to be able to honor and be connected more and more with time, not be stuck. Stuck doesn't sound good. And
So you're actually more connected in time if you can get rid of the overwhelming feelings around the event.
Let's stop for a minute and just take kind of a little historical look at EMDR, and then we'll have Dr. Jean Schellenberg come on, and we'll talk to her a little bit more about her process, and then I want to talk to you both together.
Wonderful.
Okay, so let's see this roll in.
Francine Shapiro, founder of Eye Movement Therapy, Sea Ranch, California, USA. How is it possible to erase a violent traumatic experience without years of therapy? This psychology student discovered the answer by chance 20 years ago while walking in the park.
When that kind of thought came to mind, my eyes spontaneously started moving very rapidly in a certain way. And when that happened, I noticed the thought shifted, and then when I brought it back, it didn't have the same charge again.
And as you do that, just track my hand with your...
This correlation has been verified on many patients, particularly war veterans, and it gave birth to a treatment called EMDR, eye movement desensitization and reprocessing.
Oh, that's perfect.
You can recognize the pioneers by the arrows in their backs. It is difficult in any field to bring something about that people don't understand.
This method enables spectacular results, especially in children, like young earthquake victims here in Haiti.
If it's a single trauma, so if it's an accident or a natural disaster or a rape, a single event, the research shows that 85 to 100% no longer have PTSD within 3 90-minute sessions.
Today, thousands of clinicians trained in this technique have already treated millions of people around the world.
And just notice where you feel it inside.
So, are you ready to reprogram your brain with this effective therapy?
Wow. Welcome to the show, Dr. Schellenberg.
Thank you. I'm really delighted to be here, especially talking about EMDR. It's a subject very close to my heart. For about the last 20 years, I've been working with loss and trauma and grief, and I did a dissertation with 100 women who had experiences of emotional, physical, and sexual abuse and how it affected their lives. So there was a lot of information about what worked, and one of the things they said over and over was that EMDR was enormously effective. So I was very encouraged by that and started doing some EMDR myself with my own childhood recovery in 1992, 93, a lot of therapy. And then I went on to work at CARA. It's a grief counseling center
in Palo Alto.
Palo Alto. They're wonderful. And I worked there for about 2 years, worked with a lot of people who had some really significant losses. And it was just wonderful to be able to deal with the grief straight on. And then I went on to do the training in 98. And I've been doing it 5 or 6 times a week in my office since. So I think probably I was thinking about the best way to really describe the process is in relating about a patient who came to me a number of years ago and what I did with her and what her situation was, because I think it really describes the process. She was 45 years old and had taken the train to my office because she had been unable to drive. 6 months before, she'd had a car accident where she turned the corner in a local area. An older man stepped out in front of her and she killed him.
Oh, wow.
It wasn't her fault, but nevertheless, she saw his body, the ambulance, the scare, trying to resuscitate him, you mentioned earlier, and she was completely overwhelmed. So for the next 6 months, she couldn't sleep, insomnia, flashbacks, seeing his face all the time, but most of all, she couldn't drive. She took the train to work.
That's really debilitating in this
really,
society.
Absolutely.
Especially here, where everybody's driving.
The train and a bus. It took her like 3 hours to get to my office.
Wow.
And when I found that out, she came in to see me and she was shaking. She was very traumatized. She started telling a story and she was crying. And so I asked her, one of the first steps in EMDR is to get a really thorough history of what's happened in somebody's life. Not only just because you want the history, but you want them to feel comfortable and feel safe. They're already traumatized. So getting to know them, what's happened in their life, helps them feel calm. And I noticed that the more she talked about it, the calmer she got. And then she proceeded to tell me that her mother had committed suicide and her brother had committed suicide years before. She had never dealt with either one of those griefs.
So she had a past history of trauma, and then she has this traumatic event.
Yes, and she'd been functioning. She'd been functioning, but she still was sort of semi-functioning. So the first thing that I did, and this often is the case, is to develop a safe place with her. It's a process that I have a protocol for, that I go through and really ask, where can you find a place, either within you or a real place, where you can feel safe? Because people who are traumatized don't feel safe.
Now, when you get her to that, what kind of equipment do you use? I noticed those kids, they had them
I saw
tapping,
that
and
on-
I thought that was interesting.
on the tape.
Now, do you use lights or?
I use
what
the
do you-
lights. I have what's called a light machine with it's about this high, and it also has the headsets that go with it with the sound. And then I have a remote control, so I sit right next to my patient, just like I'd be sitting. She'd be right here, or he, and I'd be right next to them. So if they wanted to reach out and touch my hand and know that I'm there, I'm right next to them, and that really helps. Plus, I write everything down that happens because it's very interactive. So essentially, once I've introduced this safe place, and in this case, I asked her to go home. She was an artist, and she wrote up this place. She came back, and I spent a whole hour just having her look at the lights, interact with her, feel safe, and then the following week, I scheduled an hour-and-a-half session because EMDR is very intense, and you need enough time.
I bet it's intense because you're getting, you're
It's
taking them
intense.
right to,
The trauma,
they're going right
They're
to,
going-
they're trusting you to take them right into the place that they least want to be.
Exactly, exactly. So it's
Amazing.
It needs a lot of grounding. So I use the first few minutes for the safe place, then go into the scene, end with the safe place, and allow time for debriefing.
Right. So now tell me, because we're not going to have that much time, and everybody's going to want to know what happened. Did she drive again?
It was amazing. After about 3 or 4 sessions, she was able to...
3 or 4?
3 or 4 sessions, but they were long sessions.
Right,
I mean,
but
first we had a
still.
session with the safe place, and then we had 3 more sessions after that. By the end of those 3 sessions, she was able to drive to my office.
Wow.
Then she realized, because it had come up within the EMDR, that she had still had a great deal of grief
Other places to go.
of when her mother and her brother committed suicide. So these were losses that were complicating this situation.
But you know what occurs to me, Heidi, when she's talking about this, is it's nice that, I mean, nice probably isn't the word, but it's great that she could get some relief so quickly.
Yes,
3 or 4,
absolutely.
even though maybe her whole life isn't some, you know, bowl of cherries or whatever now, she's able to get some relief from the thing that's most
And
traumatizing
do some
her.
of the basic things that she used to do, like drive
Yeah.
a car.
Yes,
I mean, that's
exactly, and get
incredible.
in a car.
Let's get from reliving it to
Yeah.
relieving it.
Right.
Yeah, exactly.
They're
That's
so
amazing.
close.
So let me talk to you both about this. Tell me, I'm watching the show now, and it's been 20 years for me, and this event comes up every so often. How do I know if I'm a candidate for this? And you know, and what if it's just been the first year? I mean,
And how do I
you
know if I'm not a candidate? Like you're saying?
Is there length? I mean, is it better earlier or later, or I don't know.
Well, from my experience, from people who have had a trauma, a recent trauma, the sooner you can process it, the better.
Well, really, is that yours too?
It may mean that you have to wait for a while. You may have to work with them for 3 or 4 months to get their history, to do other things, to do some safe place, to do some other kinds of work with them to make them feel comfortable with you. But you're basically trying to establish a kind of safety so that they can do a little natural grieving. For when I was at Cara, people just sometimes they just wanted to talk about the grief.
Yeah.
So some people just want to talk about it for a while until they're ready to go into the process. And then you can explain the process to them and how it works.
How about you, Christopher? Is that your thought? That
It's much the same. And as Jean is saying, there's a time of creating safety within them, with skillfully creating safety, so that we're not just ripping open Pandora's box by any means. We're skillfully, in fact, our job is what's too fast, too slow, too much, too little, in opening up Pandora's box. As you say, this is their nightmare, or it's where the heat is. So we'll do things first to just build the relationship between us and the relationship within that person. That's what things like safe place and other skills are, so that they can skillfully create safety within themselves. So that takes a little bit of time.
You're going to go slowly.
Yeah.
It sounds like an unpeel the onion slowly.
Yeah.
And they have to be in the room with you, I'm assuming. You can't do this over the phone or on Skype or anything. Is that correct?
It's such a integral process and such an intimate process because there's so many parts. There's as I think Christopher mentioned earlier, you're looking at their body. What's been stored in their body? There may be a great deal of pain in their stomach, in their heart. They may be sweating. They may be all kinds of sensations. This isn't something you could possibly do over the phone.
Well,
nor would it be safe.
Yeah, the trauma is such a physical experience.
Absolutely.
So recreate. I mean, you're going to have the physical experience, I would assume, with the trauma when it's been that strong. Christopher, I wanted to ask you. I'm thinking about this as a process for men. A man dealing with a man and doing this process. That's intriguing to me because, you know, men want to be macho, maybe some avoidance.
There's a World War II soldier who did me a favor. 20 years ago, I worked at Zen Hospice for 1 year, just 5-6 hours a week for 1 year. And a man who was in one of the groups, he stood up, and long story short, he was John Wayne. And he said, after a while of listening to all these San Francisco in its great diversity, a group of men speak, he said, you know, I learned something. I thought all my life strength was holding down feelings. You all have taught me strength is bringing it up. And this is what male, female, with male, female, we want to invite them to grow. Because in a way, what's getting tangled up is the information, the feelings, and what we're doing with EMDR is we're letting the information flow so it can grow again, and again, with a sense of their own unique wisdom. This is very client-centered. It's important to say there's not a philosophy or an ideology. We're really getting people to wake up in their own cultural and personal way. I like to say it's waking them up to their own personal mythology, because we all have an exquisite inner world, and at times it gets tangled up. We try to integrate it.
Okay, I like you guys, and I am watching this, and I'm saying, wow, I wish I lived in Palo Alto.
I was thinking that. I was just thinking that, and I'm wondering, I don't know where you're going with this, but go on. 'Cause I have
You
my
can
own
go
idea.
with it. I'm wondering, how do I find somebody who does EMDR that looks like you guys and that I can trust and has been in it for a long? I don't know. I mean, this is my
I think
this is my biggest nightmare. How am I going to find that?
That's a very important question, because I think it's such a powerful process that it really has to be done by a very skilled clinician.
Yes, that's what it sounds
because
like
it
to
can
me.
really open things up, and when people aren't ready, it can be very scary. I have worked with people who have done EMDR at various places for 15 minutes, left, and been told they're fine. They're terrified.
Yeah.
So it takes time to just to reprogram that this is not going to be that kind of experience. So I think it's important to really research people who've been clinicians a long time, who do more than just EMDR, but do EMDR and do a lot of other things, and have a background of working with trauma.
Right.
You know, essentially, these days people on the website find out what their history is.
So look for somebody who's got training, who's been a therapist for a while. And also, Heidi always says, if you've got a therapist and you're not a good match, then go find somebody else.
That's right.
Absolutely.
You know, don't just go to
and
somebody.
I guess I would also say, if you're stuck in the trauma narrative and have been, I would really look at maybe transferring it to a therapist that has
That's
EMDR.
another point.
Getting out of where you are
if
right
you've
now.
been with your therapist for years, and don't be
Yes.
afraid to make a change out of the.
Well,
you
there
know,
is
out of
something important to mention about, as you mentioned, trauma narrative, because there's someone named van der Kolk, who's one of the just kings of trauma. He's at Harvard. Unfortunately, just before my dissertation, he came out with these fMRI studies showing, really validating that we understand what's going on in the brain. It's not just speculation. And yet it goes
You
farther.
know what? I'm going to have to close the show on that.
to learn more about
Yeah.
him,
Yeah.
Yes.
it sounds like we need to go to his website.
Yeah, we can go
Yes.
to the website, and I think we've got your site on, both of your sites online.
Great.
So we are going to close the show with Randy Cookson singing playing on the keyboard, I'm sorry, not singing Stephanie Lane, and he wrote that for his wife, and we want to thank everybody for watching Grief Relief today, and have a great day.